Tackling the ethnicity pay gap is so important because we see from various different studies how at different bandings in the NHS, you get predominantly ethnic minority groups. I think if we're able to tackle the progression and pay gaps, we will start to see a diverse workforce, which will enable some of the challenges to be solved.
So what we know is that ethnic progression and ethnic pay gaps represent a huge problem. And what we also know is that a large population of the workforce in the NHS are also from minority groups, approximately 30% or 1 in 3 people. And so it's essential that we get to the bottom of this and go under the hood to understand what the drivers are of these pay gaps and progression gaps, and understand the facilitation programs that might be able to support change.
We are going to analyze the data from 1.7 million entries, as well as invite people to share their experiences through focus groups and interviews, and that will give us a real deep understanding of some of the practical ways in which the progression and pay gap can be reduced.
I think one of the things I've learned is how clear it is and how big the problem is. I call the RHO 2 things: an excuse remover and a mirror. If we say what we say we should be doing in the NHS and social care system, then this is the mirror that says, are you doing it? And if we say we don't know, these are the people that say, actually you do, this is the evidence. The only reason for not doing it is not because you can't, it's because you won't. The first thing I'd like people to take away is that this isn't a political issue, and it's not a kind of a moral choice either. You're either a good leader, in which case you're leading all the people everywhere all the time, or you're not, in which case you're leading some of the people somewhere some of the time, and you should be paid accordingly. It's not difficult. So I'd hope that people will take away from this that this is about good leadership and good management.